Oh my god, now I know why the squad is so mad at Israel. Because it's going to blow up its pet project, so they just figured they return the favor in kind. No, that's probably not the case. They're all just evil. Harvard epidemiologist. Israeli medical study on natural COVID-19 immunity may render discriminatory and unethical vaccine passports unnecessary. And also a side note, because they declared, the CDC or whatever the fuck, I think the WHO also signed off on it, but racism is a public health crisis. Just follow me for a moment. Because, vaccine passports disproportionately will, whenever they're implemented in whatever city, they will disproportionately affect minority communities. Therefore, they're working at solving racism at the same time as they are working at solving the coronavirus pandemic. It's a fucking magical miracle that we could have only wished for, and we got to thank the Jews for getting to the bottom of it. Yes, let's take a look here. A medical study published in August in Israel has perhaps undermined the need for vaccine passports in countries where it is currently a necessity. Yeah, ain't that weird? In the most developed nations, some of the other, one of the normally the ones that get pointed out as being socialist paradises or democratically socialist places, even though when you ask the people who are running the places like Denmark and Sweden, they're like, no, we are much more capitalistic and very much not so much socialist. But nice try though. Shut up, Bernie. No. All of those places, yeah, they're dropping their restrictions as quickly as these fucking losers drop their drawers. Then again, it's just the developed nations who just want to run with these vaccine passports. Well, not for long, apparently. That's why they keep banning different fucking hashtags or different sort of communal efforts to discuss natural immunity, because that one right there, yeah, it's looking like the best protection your body can find. According to Science, not the science, not actual science, the magazine Science. The natural immune protection that develops after a SARS-CoV-2 infection offers considerable more of a shield against the Delta variant of the pandemic coronavirus than 2 doses of the Pfizer-BioNTech vaccine. That's according to Science. Ain't that a fucking bitch? I guess that's when Mu and Lambda are going to start showing up as soon as this starts making the rounds. Okay. Newly released data shows that people who once had a SARS-CoV-2 infection are much less likely than never infected vaccinated people to get Delta, develop symptoms from it, or become hospitalized with serious COVID-19, Science continued. Very interesting. Following the growing trend of requiring proof of vaccination to carry out one's everyday life. Very true. Harvard Medical School professor, clearly some fucking kook, obviously, Martin Kulldorff, said the research results means vaccine passports are both unscientific, you really needed that article to prove that, as well as discriminatory. There you go, as many working class people have yet to be vaccinated. That's the most under-vaccinated, not vaccinated, self-actualizing people that are out there. Prior COVID disease, many working class provides immunity better than vaccines, many professionals. So vaccine mandates are not only scientific nonsense, they are also discriminatory and unethical. Kulldorff, a biostatistician and epidemiologist, wrote on Twitter. Don't mind the medium, just the guy who's mentioning it is fairly respected in the field. Moreover, CDC research shows that unvaccinated individuals still get infected with COVID-19 and carry just as much of the virus in their throat and nasal passages sexy as unvaccinated individuals, wrote the Foundation for Economic Education. High viral loads in the throat and nose? Okay. All right. Okay. Maybe this is just a joke on everybody. Suggests an increased risk of transmission and raised concerns that, unlike the other variants of vaccinated people infected with Delta, it's so funny, right? I will never stop pointing this out, but we'll get to the end of this before I do. Can transmit the virus. CDC, Rochelle Walensky, director, whatever, fuck her. Fucked up there on the byline, but whatever, who gives a shit? Yeah, if you've already been sick with it, hi. It looks like you got yourself a pretty good natural immunity, which is something that's a little verboten. You're not supposed to be talking about that, but it's so funny, right? With these different variants that are out there, you're allowed to describe them based on the areas that they're first described, but you're only allowed to refer to the coronavirus in a politically correct sense as COVID. Or the coronavirus. You're not allowed to call it the China virus because remember, it came from China. And because we know everything we know about natural immunity now, oh, and because those damn dirty Jews conducted the fucking study, who needs to look at that kind of stuff? Because we have Dr. Wen, and here in Canada, we have Dr. Tam. They look actually, no, I got to rescind that for a minute. Not for any, like politically correct stance or anything. Dr. Tam looks at least 98 years older than Dr. Wen. So clearly, CNN has the winner here. I guess they have the best old fucking shaman under their employ. According to her, though, even with all of the new studies that are coming out and even just stuff on the fucking CDC website that shows transmission between children is incredibly low, and they're mostly just concerned with transmission among the administrators. So, at older populations, we are nowhere near removing masks in schools. Well, that's good. I'm glad CNN's doctor can point that out. On Thursday's CNN Newsroom Network medical analyst Dr. Leana Wen. I'd love to know the last time that she actually seen a real patient or anything like that instead of just doing her TV spots. I'm just wondering. Weighed in on the prospect of optional masking in schools. Oh, Florida's killing kids. Yeah, just look at the numbers again, stupid. When advised that once there's rapid testing for students and teachers, and when vaccines are authorized, wow, those goalposts, they're so convenient, thanks now that they're on wheels, for children could see masks coming off, but she clarified that the United States is nowhere near that. Obviously not. Would you like to quantify that? No? Okay, figured. I agree that masks are a very powerful rare of protection, but that's only one rare. When outlined, and if we have so many other rares that are present, masking may be one that could go away. But I would say that no, never keep mask on all the time. You be sick. Show you're sick. No. She continued after picking up her bag of cans that she dropped on the side of the road. Everybody is vaccinated in that class, and that the level of community transmission is declining. I could only imagine the situation where we remove masks because I don't know, people want to live their life and they start to rebel against the elites and fucking CNN's ivory tower. All of that reads is just stop questioning us. We will tell you when life will return to normal, and we will never tell you the goal in which we need to hit in order to return to normal. That's for us to know. It's a big club. You ain't in it, and you're on a need-to-know basis, and more cliches. But again, okay, so you're not allowed to take off your mask. You're not allowed to mention natural immunity. You're not even supposed to mention the symptoms and how they manifest in children. How about this, though? When it comes to the Delta variant, the kids are all right. Unless they're in Florida, then the kids are alt-right. Am I right, guys? Parents are naturally worried, are they, about sending their kids to school amid the Delta variant. Really? Are they? Just, you should be worried for other reasons for sending your kids to public schools, but okay, especially those kids who are under 12, who are too young to be vaccinated. Ugh, I've seen some posts of, I think NBC put out the clip where for his 12th birthday, little Timmy received the coronavirus vaccine for his birthday gift. I've had shitty birthdays before. I've dropped a knife on my foot before on a birthday, but I think that would probably take the cake. According to the survey updated in August by researchers at the University of Southern California, nearly 1 in 5 families, 18%, were considering not sending or planning to send their kids back to school because of COVID-19 fears. Let us assuage those fears because parents and school administrators are understandably nervous. More fear, more fear, more fear. It is crucial to weigh the risks of the virus against the downside of keeping children out of school. I don't know, especially if you got private school or you're going to homeschool, I don't know what the downside is. But there is little evidence that the Delta variant is more dangerous for kids than early versions of the virus. Oh my God, it spreads more easily, yes. Where's your numbers on that? But the minuscule death rate among infected children continues to drop compared with versions of the virus circulating last year. Huh. But you should still be scared, though, and read through those first couple of paragraphs before we actually get to the meat of this. By the end of July 2021, more than 80% of COVID-19 cases, adults and children, were caused by the Delta variant. Again, it's more prevalent, doesn't mean that it spreads more, but okay. According to the data for the Center of Disease Control and Prevention, oh, that sounds very formal. It sounds like an alarming statistics, and in some ways it is, but it isn't. Let us tell you why. But when it comes to children, the facts don't lie, and you're going to have trouble at sacrifice. In July, 8 children under the age of 15 died. Now, that's just 8 kids too. I know it kind of sucks that kids die of this shit, but when you compare it to 17 in July of 2020, well, I guess it's survival of the feminist. Wow, survival of the fittest. I guess we've been doing too much research for the day. Some of the decrease may be due to improved treatment and vaccination of children 12 years and older. Yeah, and if they want to use monoclonal antibodies and they're in the South, you're going to be shit out of luck because there's rationing that needs to happen. Not because there's a shortage or anything, just because Biden's vindictive. But the case fatality rate for children too young to be vaccinated is lower than last year. Okay, so it's getting better. No shit. Even older variants are not particularly dangerous for children. Shut up. You're going to blow everybody's cover. According to the CDC, of the 633,786 COVID deaths since the pandemic began in February 2020, drumroll please, 470 were children under the age of 18. Under the age of 18. Okay, how many of those were, I don't know, like 15 to 18, or like really sickly, just about to turn 18 groups? You know the ones I mean. Any child's death is tragic, yes. Oh my god, and clutching my I don't care. But this is also, affecting every other kid that is having currently a very fucked up childhood. All because a fraction of a percentile of kids are dropping dead. We don't even know how sick they were to begin with, but still, it's a very, very tiny number. We also don't shut down schools or keep kids home from a respiratory syncytial virus, or RSV, another virus that most kids have for the age of 2, that kills anywhere between 100 to 500 children under the age of 5 every year. Wow, that's even a smaller and more deadly demographic, but yeah, that's fair. That's fair. But let's go back to that original paragraph there. Any child's death is tragic, and this number needs to be put into perspective. COVID-19 deaths among children last year compared in the numbers of children who die annually in automobile accidents, 636 in 2018 is the estimated 480 deaths from the flu among the same group during the 2018-19 flu season. As Martin Kulldorff, hey, that guy again, professor of medicine at Harvard Medicine School, put it, we don't shut down schools in flu season. Yeah, when you consider 480 kids drop dead between 2018 and 2019, and then for the 2020 season, for the entire fucking year, not just the flu season, 470 kids under the age of 18. All right then. Last year's school closures should be instructive to any parent thinking of yanking their kids out of the classroom. Yeah, just homeschool. Do a whole lot better for your children. You'll be doing them greater in the long run. The chances are good that before long, vaccinations will be available for children under the age of 12. Why? You just ran down the numbers. Why do you got to sell your fucking position down the river like that, you dumb cunts? Probably beginning around age 3 to 5. Ugh, the ultimate comfort for parents may be, I don't know, in their paranoid schizophrenia. These are probably the same cunts who want to wrap their kids up in fucking bubble wrap whenever they hear, oh, we're going to be playing football in gym. Not my little kid. He will not be participating in that barbaric behavior. Yeah, fuck off. So, hey, good news. Good news to start off Sunday. That's kind of fucking weird, right? Delta variant's not really coming after kids. Dr. Wen is a blowhard, and Israel's telling you that natural immunity fucking rules, which is, hey, awesome. You know what? Now we got to talk about corruption in Canada. I know, right? That didn't take very long for the new government to fucking run afoul of the law. It's kind of their trademark, though. With that said, I thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.